If you live a long way from our clinic, we don't expect you to come back for the 1 week and 2 week check visit. It is our preference, of course, that we check our patients live, so to speak, but we are a long way away from many of our patients. They're coming from all over Victoria, they're coming from interstate. So we don't expect you to come back if you live a long way away. So we ask you to send us some photos. Taking photos for babies can be challenging. Taking photos for older children, a little bit less challenging. But for babies, it can be really difficult and can sometimes take 3 adults to take photos. For babies, you need one person to hold the head still, one person to lift the lip up if we've done a lip tie, to lift the lip up as if you're doing a stretch right up to the maximum position, where the lip is covering the nostrils and the tip of the nose. And then take a photo really up close. I only want to see this part of your baby's face. Using a smartphone and a flash is fine. The tongue is also even more challenging. 2 fingers under the tongue on either side of the lasered area, pushing the tongue up and back towards the tonsils. So once again, at the maximum stretch position, and take a photo using a flash. You may need to take a dozen photos before you get a decent photo that shows all of the lasered area and is in focus and is suitable for me to use. We then ask that you send the photos to our email address tonguetie@coburgdentalgroup.com.au with your child's name and date of birth and the D for W number that should be on your receipt. If you don't have that number, that's fine. At least your baby's name and date of birth so they can be identified. I will then respond to your email with the photos. If the photos are satisfactory, I'll give you further instructions on further stretches or how the healing is progressing. If I'm not happy with the photos, I will ask you to retake them, unfortunately. If we're still struggling with the photos, then I will ask you to return to the clinic so that I can check your child out and make sure that the healing is progressing well. I don't give the responsibility of checking the healing to other dentists, to the referring practitioners. I don't think it's fair on them if they haven't had the appropriate surgical training to check on the healing. That is my responsibility. Many of the people who do refer to me have a fair idea about what good healing is and will give reassurance to parents about the healing in their child, but ultimately the responsibility is to me. So while the photos can be challenging, it's certainly much better than driving all the way back to our clinic, and the vast majority of parents can do them, although it might take some perseverance.